And always remember that it's very important to care for yourself as a caregiver. So that was mentioned earlier in the presentation. So taking time for yourself, your needs are just as important. Sometimes we often forget this as caregivers. We put other people first and we put ourselves last. So making time for yourself can help you to be a better support. So schedule things to do for yourself, even if it's just for a few minutes a day. So maybe it's listening to music, stretching, calling a friend and talking to them. If the weather's good, it's not snowing or raining or sleeting, go outside for a quick little walk around the block. Go down to the river and look at the water. Meet somebody for a coffee or a tea. So very important for you as a caregiver to make time for yourself. And it's important to take care of your entire self. So body, mind, and spirit. Make sure that you're attending your own appointments. If you have a doctor's appointment, a dentist appointment, something important that you maybe you've been waiting 6 months to go to see a specialist. It's very important to keep your own appointments. Eating balanced meals, getting enough rest and sleep, taking time to relax, maybe perhaps exploring self-help workbooks and websites. Talk to your primary care provider or a counselor if you feel that you need some extra supports, and participate in religious or spiritual activities that are appropriate for you. Find meaning. Cancer can shift meaning and make us look at life in new ways. Focus on what you value most. Talk to other people who are going through a similar experience and find meaning through other techniques such as mindfulness or meditation and relaxation. Helping to stay organized can be very helpful as well because it lowers your anxiety. So keeping a folder for health information, notes, and other important phone numbers. Taking notes of things to ask or tell the medical team. Try doing one thing at a time. Consider a friend, a family or friend being part of the communication plan. And asking for help as needed to prevent exhaustion and caregiver burnout. So one of the things that we can do as social workers here, and I probably get to it in a future slide, but one of the things that we can do is meet with, the individual and their primary caregiver, and reviewing, even just before a doctor's appointment, going over and reviewing some questions that they might have and helping them so that when you're in the appointment, the individual can focus on what the doctor is saying and the caregiver can take down notes so that it can be referred to when you get home or after the appointment. So paying attention to yourself and how you're feeling, both physically, emotionally, and psychologically. So we refer to this sometimes if you are not doing well and not coping and managing well as a caregiver, we refer to it as caregiver burnout. So the word burnout describes the exhaustion of physical or emotional strength. So seeking help if you find that any of the following are happening to you. If you're having like the urge to run and hide from responsibility, if that becomes really strong and you're just so exhausted, you just can't deal with people anymore. Your activity is scattered and frantic. There's a major change in your sleeping patterns, such as sleeping less than 3 hours, or sometimes it's sleeping more. Eating habits change and you suddenly gain or lose more than 10 pounds. You're often irritable or easily angered. Important details are forgotten or you cannot concentrate. And you find yourself perhaps using extra alcohol, drugs, or tobacco to cope. So consider some type of a respite. If there's, if you're the only primary caregiver and there's not anyone else around, there are places like such as retirement homes where individuals can go. For example, it has to be generally a minimum of 2 weeks, but there could be places that somebody could go and you can have an opportunity to get some rest and take a break. And consider talking to a social worker here at the Cancer Center. And you can request a referral from the care team or you can call and self-refer. So this is a great quote that we thought was really very helpful. So self-care is not selfish. You cannot serve from an empty vessel. It's very important information, very important quote. And I think we can all use this quote at different times in our lives for various reasons, not just with caregiving.